started. We are very happy to have our new policy director, Tiffany Gladney, today, who is going to be giving us a basic Budget 101 kind of overview here in North Carolina and how that process works. And as most of you all know, this is the big budget year for North Carolina, and we will be hopeful that they come out with a budget that's good for children and families. And Tiffany's going to give us a little bit more background there. And then she will also be providing our legislative update this week. So double duty today, and there's been a lot happening legislatively as well. So we will be turning it over to her. And then prior to us adjourning too, we do have a few slides we want to share about our Voices for Children event that's coming up in April. And we want to make sure that we just share that information with you all. We hope everyone can join us. We're going to have some wonderful award recipients. Here's some information right here where you can reserve your spot. It's going to be virtual. It's going to be an hour in the morning, you know, get the day started on a happy note, celebrating some wonderful folks. And we really hope that you can all join us as part of that and spread the word and encourage other people to join us as well. Right here is a special preview of some of our wonderful award winners. The Tom V. Advocacy Award winner, Cassandra Brooks. Miss Cassandra is just an incredible advocate, child care center owner, been doing wonderful work. And so we're going to be very happy to honor her. And then our 2 Community Voices Award recipients. Peach in Durham, who does amazing environmental health justice type work, and Soaring as Eagles down in New Hanover County. And we're just so pleased we can celebrate them and let everyone know a little more about their wonderful work as well. So please register, spread the word, let Ileana on our staff, of course, know, our development director, if you have any other questions or any help you may need in getting the word out. Okay. Thanks, everyone. And without any further rambling from myself, I am now going to turn it over to Tiffany.
Thanks, Adam. Good morning, guys. You all. So as Adam mentioned, I am Tiffany Gladney, the new policy director here at NC Child, and I am so excited to present today on Budget 101 with you all. So I like to keep things loose and fun and engaging, so please laugh at my jokes, even if they're corny, and ask as many questions as you want. So chime in, use the chat feature. So next slide, please. And also, if I'm looking around and looking crazy, it's because I'm looking at the notes in my PowerPoint. So if I look like I'm looking off, I promise I'm paying attention. So,
all right, Tiffany, I need to pull up your slides. So hang on just a second while I get those. If you want to get started, I'll make the slides work in a second. Okay. Sorry about that.
All right, so we're going to go ahead and talk about the key players. So oftentimes, I'm going to give you some caveats before we get into the timelines and the nuts and bolts of the budget process. So of course, you have your frontline key players. So those are going to be, you know, the people that you see in the news oftentimes. But then you have your players in the background, so to speak. So your senior budget writers, your appropriation chairs. So then, of course, you have your forefront folks. So you have Governor Roy Cooper, of course, who is a Democrat. Then you have Speaker of the House, Tim Moore, who is a Republican. And then you also have Senate President pro tempore, Senator Phil Berger, who is also a Republican. So if you can't tell by that, oftentimes that leads to a little bit of disagreement when it comes to the budget. So next slide, please, Fawn. So when it comes to the timeline, oh, Fawn, I think you have the first version. Do you want me to share my screen?
Yeah, if you don't mind. I'm so sorry. I have an older version up here, and I know you did a ton of work on this after that.
Yeah, no problem.
I apologize.
She wanted y'all to see all the background work that goes into it. Okay, can y'all see my screen?
Yes, we can. This is really just part of our hazing process, Tiffany.
Here for it. I like hazing. Okay, so when it comes to the timeline, so this process starts in the fall, or started in the fall of 2020. So in the fall of 2020, the Office of State Budget and Management sent out instructions to all of the state agencies to say, okay, get ready to get your proposals together. We're going to start meeting with you guys in the late fall, early winter. So you're talking about DHHS, your DPI, your DMVs. Go ahead and start putting together your allocations and what you would like to see us invest in the governor's budget proposal now, so we can start meeting late fall, early winter. And so that's exactly what happens. Let me back up for a second. This is in a perfect world. So we're all going to put on our pretend hats. This is no hiccups, no drama, in a perfect smooth sailing world. This is how the budget process would work. Okay. So in October, December, the agencies would start meeting with the governor's office and his staffers to go over their budget proposals and to figure out what's feasible and what's not so feasible, or what's too ambitious. So in the winter, the General Assembly reconvenes for long session, usually in January, and long session is always odd numbered years. So obviously 2021, we're in a long session. Even numbered years are going to be your short sessions. So the budget is for a biennium, so 2-year session, 2 fiscal years. So the governor usually finalizes the budget, recommended budgetary proposal come February, March. And this is actually very timely because the budget proposal from the governor's office is slated to be released early next week to the General Assembly. So everybody's highly anticipating what's going to be in the budget. So I have a feeling the General Assembly's website is going to be blowing up next week. Everybody's going to be listening in to see what exactly is in it. And the governor's office will present the budget to the General Assembly. So usually it's a joint committee session with both House and Senate appropriations committees coming together. So it'll probably be Charlie Peruse, honestly, who will present it. March to probably May, June to dissect the governor's budget, and they will completely assess it, and they will figure out what they like, what they don't like about the budget. But while they're doing this, they are also composing their own budgets. So the House will come up with a budget, the Senate will come up with a budget, and of course the governor has his own budget. Obviously, the language has to be identical for the state to have a budget that is passed and certified. And of course, that is where things get a little complicated and convoluted. So that is what leads to budget negotiations in conference. So oftentimes when I'm speaking to folks who are new to the lobbying advocacy world, and they'll say, what is a conference committee, conferees, what is all of that? I say it's similar to mediation. So the House will elect certain representatives, the Senate will elect certain representatives, they go behind closed doors and they have a come to Jesus meeting or mediation, and they figure out some kind of compromise language for the budget that they can both vote on and feel good about, somewhat good about, that they can present to the governor. So the governor has a few options when it comes to the budget. And I kind of snicker about that because I think that anybody in North Carolina has probably heard in recent years about the infamous budget veto and then veto override. So the governor can either sign a budget into law and certify it. The governor can do nothing. And after 10 days, the budget will become law automatically. The governor can veto a budget, as we saw last time. at which point the General Assembly can try to override that veto, but you need 3/5 of the General Assembly to do that. We saw that September 11th in the House, where they voted to override the governor's budget, but it has to happen in both chambers. So it can get really complicated and really sticky. It is a very interesting process. So there's a lot that can happen here. The state has been operating off of an older budget because we haven't had an updated budget due to the budget override last session, which of course centered around disagreements around Medicaid expansion and a few other issues. So I'll pause there for a second before moving into the next topic, which we're going to touch on some bills that we are tracking here at NC Child that are relevant to our mission and our advocacy agenda so far this session.
Guys, if you have questions for Tiffany, please drop them into the chat box. And Tiffany, I have a question for you.
Sure.
I know that, we think of the budget as just being about numbers, but a lot of times I know bills get stuck in there and policy stuff happens. So I was wondering if you could talk about that for a second too. It's like how much policy gets done in the budget.
Yes, that's actually a very good point, Fawn. So oftentimes you'll see freestanding bills, which is actually what we're about to talk about in a second. Oftentimes they'll get rolled into the budget as well. So it might be, let's say, Adam, Fawn, Kaylin, and Eva and I really like ice cream, and we lobby our legislators to create a bill that NC Child loves ice cream. And there's, we have been working this bill at the General Assembly. They can roll that into the budget and add a line item for us to have unlimited ice cream at NC Child's office. I see some thumbs up there, and they can just roll it into the budget instead of it being a freestanding bill. It just becomes a line item in there, which oftentimes we do see that during the budget session where a lot of bills just kind of get rolled into that process. That was a very good question, Fawn. Thank you for that. So I'm trying to see questions, but because I'm sharing my screen, Fawn, you might have to read them to me.
Yeah, and let's see. So Leslie Kellenberger is asking, isn't this how Raise the Age passed is getting rolled into the budget?
Yeah, if I'm not mistaken, y'all correct me if I'm wrong. I'm 3 weeks in here, but if I'm
yeah, I think that's what happened with that one.
And Frank Crawford's asking about, like, what's your assessment of the sort of political tone? I think, Frank, are you meaning like the partisanship kind of tone with respect to budget negotiations? I don't know if that's what he's asking, like maybe in general or even right now with this process, because there is that Republican Democrat push-pull there with the governor and the General Assembly.
Yeah. Frank, do you want my honest answer? I would expect more of what we've seen when it comes to that. We did see a little bit of bipartisanship with like the school reopening and, Senate Bill 37 with the governor and House and Senate leadership. But it seems like Governor Cooper is still very committed to seeing Medicaid expansion or something of the sort. There's talk that, the General Assembly might be more open to some kind of compromise when it comes to that. But when it comes to the budget, I would be surprised if we saw a lot of bipartisanship, to be completely frank. No pun intended, Frank. That's your cue to laugh, y'all. I told y'all it's not supposed to be stuffy.
Tiffany, when you were talking about the players earlier, you were mentioning Berger and Moore as head of the House and Senate. Do you want to talk at all about the appropriations committee chairs and kind of the power broker role that they play?
Yes, absolutely. So with the power brokers, your appropriation chairs, your Jason Sains, your Donnie Lambeths, your Jake Johnsons, your folks like that, they are the ones who are sitting down behind closed doors and actually writing the budgets. and are the folks that lobby us, like myself and Ashley Perkinson. And, those are the folks that we're really working to make sure that they keep in mind babies and children, and making sure that they keep in mind our advocacy agendas, because they are the ones who are really making sure that Raise the Age is included in the budget, and that these important line items are in the budget. Because like I mentioned in the beginning, you have your people who are at the forefront, your Speaker Moore and Senator Berger and Governor Cooper, but it's really those power brokers in the back end, your Representative Lambeth and Representative Sane, and those powerful folks in the back end who are really the ones who are composing the actual budget that will ultimately be certified, that really wield a lot more of the power and authority there. So it's very important to work all angles of the key players, and understand that you have your, as with many things when it comes to business, you have your big wigs who kind of go out and do the press conferences, and then you have your staffers who really are in the trenches writing the actual budget.
All right, I'm not seeing any more questions coming into the chat box, but folks, you can continue to enter questions in the chat for Tiffany as she goes through the rest of the presentation. But thanks, Tiffany. That's a great overview, very demystifying.
Thank you, ma'am. So now we're going to shift gears, and we're going to talk a little bit about the bills, which is why Destiny's Child was playing when many of you jumped on. So I have to give the disclaimer that bills are still being filed. So the bills that we are going to discuss are, as of today, March 19th at 11:21. Okay, so bills can still be filed. These are just the ones that we are going to speak to today. So I wanted to let you guys know where we stand on the issues and on the bills. And I figured, what better way for a child advocacy agency than with some cute babies? And as the proud auntie of 13 nieces and nephews, why not use my own nieces and nephews? So you'll see here, Sophie Page, my niece, will convey what we support. Ezekiel Clark will convey monitor, because he's on the phone, clearly getting more information on something. And then sweet baby Hunter will convey what we oppose, because he is offended in the bathtub, obviously. So, and then you'll also see that the check mark will notate what are advocacy agenda items for us here at NC Child. So they actually are something that we had on our agenda, and we have identified a legislative champion, and we are actively working with that person, that legislator, to get this policy proposal moved into law. And for support, that means we are actively working it. We are sending action alerts. Ashley, our contract lobbyist, is actively working it on Jones Street. I'm actively working it. We are all resources devoted to this issue. Monitor means we are assessing it. We are doing our research. We're looking at the language. We're trying to figure out, what are the unintended consequences here? What could this mean for North Carolina babies and children? Oppose means we are actively working this issue to try to make sure it does not get passed into law, because we understand the ramifications and that they could be detrimental for North Carolina babies, children, and families. So keep that in mind as we move through this presentation. So when it comes to health, we're seeing some really good legislation this session. So with Senate Bill 93, assisting North Carolina families in crisis, this piece of legislation would allow parents who have temporarily lost custody of their children to still receive their Medicaid benefits, specifically if they are in substance abuse treatment or some kind of mental health care treatment center. So House Bill 144, this one focuses on dental hygienists and allowing them to practice telehealth, but also administer anesthesia and things of that nature. So when it comes to House Bill 272, revise the health standard for lead, this is something that we celebrated, and I hope we will continue to celebrate for the rest of the session and beyond. This updated the health standard for lead poisoning, specifically in childcare centers and beyond. This directly lined up with one of the items on our agenda, and it just goes right in line with making sure that we are keeping children safe, whether they are at home or in childcare facilities. House Bill 316, this bill is brand spanking new. It was just filed this week, actually. This would extend postpartum Medicaid benefits for moms from 6 weeks, only 6 weeks currently, to 12 months. So we greatly applaud this legislation and hope to see it move. So then lastly, we have House Bill 249, the SAVE Act. This is a piece of legislation that we've seen in previous sessions. This one really focuses on increasing the scope of practice when it comes to nurse practitioners and healthcare practitioners similar to nurse practitioners. So family financial security. So Senate Bill 181 is reinstating the earned income tax credit. So that one is just as its title states. And that is, making sure that families can get the earned income tax credit. And the DES COVID modifications, that one, actually, y'all, I have to quit for a second out of the full screen. So this one, it will actually postpone the unemployment tax hike for businesses and extend COVID related benefits. I had to cheat, y'all, and look at my notes for a second. So juvenile justice. So as you can see from Sophie Page, we are thrilled about this entire slide. So House Bill 261 raised the minimum age of juvenile jurisdiction. So this one would increase the age of what is defined as a juvenile delinquent from age 6 to a minimum age of 10. H225, the prosecutorial discretion / juveniles, this would allow the prosecutor to use their own discretion for misdemeanors that range from felonies A through G. And Adam and Fawn, y'all jump in if I'm misstating something because I can't see my notes. So y'all jump in. And then House 173, separate juvenile justice and adult corrections, is exactly what its title says. So this one would separate the two correction systems. So juvenile and adult, two separate departments. Child welfare. House Bill 41, amend lawful age to marry to 18 years of age. So this would amend it from age 14 to age 18 years or older. House Bill 205, abuse and neglect resources in public schools. This bill, we have some concerns with this bill. Not only would it put resources about abuse, including sexual abuse and neglect in school systems, but it would also put some of the reporting responsibility on the child who is being abused. So that bill has been moving in the House this week. So we're keeping an eye on that bill. And Senate Bill 69, DMV licensing requirements and outsource test, driver's test. This bill would decrease the amount of practice hours that a teenage driver needs to get their provisional driver's license. So we are also keeping a close eye on that bill as well. Early education. So this would add more allocations into the Smart Start funding, including $15 million for childcare related activities, $3.75 million for childcare subsidies, and so much more. So we're excited about that. Immigration and family separation, another really concerning block of legislation that we've seen recently. So Senate Bill 101 would require cooperation with ICE, requiring local sheriff's departments and agents to cooperate with ICE agents to hold suspects that they feel have could possibly be illegal immigrants and things of that nature. And House Bill 62, the immigration compliance ordinances, could jeopardize a city's funding if they are considered a sanctuary city. So here are some important dates to keep in mind. And this is my nephew, sweet baby Justin. So March 25th is the local bill filing deadline in the House. April 6th, the bill filing deadline in the Senate for most bills. April 20th, you have your non-budget finance bills, last day to file those in the House. April 27th, your budget and finance bills in the House, last day for that. And May 13th, which is a crazy, crazy, crazy day for most folks who work on Jones Street, crossover. Dun, dun, dun. So with that being said, and lastly, Sweet Kaya with my dog son Ace on Halloween. So if you guys have any questions, sound off.
We got a bunch of questions in the chat box, Tiffany, and I know we have lots of experts on the line too, so that is a good thing. Let's see. The first one, Melissa Johnson was asking about extending maternal Medicaid postpartum. Kaylin, if you're on the line, do you want to take that one? What are the implications of the American Recovery Plan Act for that postpartum extension?
Absolutely. Good morning, everyone. So I'm Kaylin Safransky, the Health Programs Director at NC Child. And basically what this piece of legislation does is allows North Carolina to draw down the federal funding that was provided through the new American Recovery Plan bill that passed last week, the week before. Time doesn't mean anything. And essentially allows North Carolina to extend postpartum coverage for pregnant individuals on delivering individuals on Medicaid from its current 60 days to 12 months continuous coverage. So what was written in the American Rescue Plan is really how we're thinking about it, is a stepping stone. So it allows for federal funds to cover 5 years of states who want to opt in to extending this coverage. This is not expansion. This is quite literally taking the benefit and just making it last longer. And we think that's incredibly important because we know that that first year of postpartum is when both the delivering parent and the infant are at highest risk for a whole host of things. And right now, the 60-day limit is really an arbitrary clock that was done many, many, many years ago. And it was just a part of kind of policy negotiations. So it really doesn't hold any water for why it's 60 days, which is why we know the longer the coverage and the more access to care that everyone can get, the better. And so that's why we're supporting it, but that is how the two are connected. So the federal bill was basically the trigger that allowed states to do this. And this bill is North Carolina saying, yes, please.
Cool. All right. We have quite a few questions and comments about House Bill 205. So I don't know who wants to handle that, Tiffany or Michelle or me. I don't know.
Yeah, I was just looking at the question.
I'm happy to take a stab at it, Tiffany, if you want,
Yeah.
and then please jump in. So we have concerns about this bill. This has come up before in previous sessions and hasn't gone anywhere. And I think the intent of the bill is, obviously a good intent, right? We want to support kids who've experienced abuse and neglect and make sure that they are getting connected with the resources to ensure their health and their safety. So the intent is spot on. The operationalizing of it is what we're worried about. So one, this bill would do two things. It includes additional information about child abuse and neglect to be delivered by schools. We're pretty sure, and this is what we're looking at, that much of that information is already included in the healthy living curriculum that schools are mandated to do. So that's one, is just duplication, and we need to think that through. And then, but second, it requires posters with the DSS reporting number to be around school systems, with the idea that children who have been traumatized are going to use the DSS number to self-report themselves. in middle school and high school. And I think we're worried about that for a lot of reasons. One is if any of you have called the DSS number lately to make a child abuse report, it's a long process. There's mandated questions. We really don't want 12-year-olds having to use the DSS line to self-report their own abuse and neglect. We really want school social workers, school nurses, and school counselors in the schools, because that's the best way for kids to get the support they need if they have experienced abuse and neglect and either have disclosed or are going to disclose or want to disclose, not calling a phone number at the local DSS. And so we are looking into the bill and going to try to get up with some of the legislators who are sponsors and co-sponsors to express our concerns about it.
Cool. I know we have a question about the Smart Start bill, House Bill 262. I think Michael Welker is on the line from Smart Start. Michael, do you want to jump on and fill folks in a little bit more on that? And if not, I think Elizabeth could do it too. So not to put you on the spot.
I'm here and happy to talk about it. So just for background, Smart Start has not had an increase in its general appropriation since I think 2007, 2008. And then in the few years after the recession, had our budget cut several times. So our current appropriation from the state is about $150 million. And in the last session, we put forward a request for an increase and then got hung up in the budget impasse. So we're gonna take another crack at it this time around. The request we put forward is a $30 million increase recurring for each year of the biennium. So that'd be about a 20% increase to Smart Start's budget. And the way it was broken out on the slide basically reflects all of Smart Start's core service areas across childcare, family support, and health. So this would be distributed up into each of those areas by local partnerships who will ultimately make the decisions on the ground about how those funds would be used. But we're really excited about the bill. We had it introduced last week on the House side. We're hoping it would get in the Senate this week, but didn't end up seeing it. So hopefully that'll come next time, but had a really great bipartisan sponsorship, a lot of support on it. So hopeful that when we go through the budget process this time around that we'll finally be able to get an increase and have more funds coming into the network.
That's awesome, Michael. Thanks so much. And if folks have more questions about that, feel free to follow up in the chat. Yeah, everybody's excited to see Smart Start money being proposed, so that's great. I see a question from Sheila Peltzer about House Bill 186. So Sheila, thank you for that update on House Bill 186 because we weren't aware of that information, but we should have added that to our monitoring line. So Tiffany, let's make sure that we're monitoring that one going forward. I can't speak to more details because it's just not an issue that we have a lot of expertise or capacity in, but we will add that to our monitoring and tracking and keep y'all updated on it.
And actually it's one that I have it on my internal tracker that I'm watching. So I've been keeping an eye on it because I took note, Sheila, when you mentioned it, I think last week. So I added it to my list last week. And I've been keeping an eye on it and I see that it was calendared, it was assigned a committee on March 2nd. So I've been keeping an eye on it. So I am watching it internally and I slipped my mind putting it on the PowerPoint. So I apologize about that. I take accountability for that, but we are tracking it internally. So I want you to know that it is on my super not pretty bland spreadsheet that I'm tracking privately. So thank you for that. And thank you for the context about Representative Stevens. That's the kind of context we need. So thank you for that.
All right. I am not seeing any more questions in the chat right now. And Michael has dropped his email into the chat if anybody wants to get up with him about more details on Smart Start. So folks, if you have other legislative or budget questions, please go ahead and drop them in here. And also if there's other bills that you think we should know about that you want us to keep an eye on, let us know because we need to hear it. And really appreciate the information sharing. So thank you. All right. I think that's it.
Okay. Yeah, absolutely. One last thing, Tiff, and I think Tiffany, we maybe attended it, but there's an early childhood caucus now, right? I think we mentioned that, and I know Mike will obviously be in the loop on that too. But maybe that will help move some early childhood education issues forward, perhaps.
Yeah, absolutely. So they actually met yesterday. Yesterday was their first meeting, and they heard from Trey Rabin of AT&T and Goodnight of SAS, and then Catherine Truitt, State Superintendent of. So they really just kind of did introductory, remarks, and then answered a few questions from legislators on, what would they suggest, the General Assembly should invest in. Representative Hunt, Rachel Hunt, had a good question about, are there some funding models from other states that we should be looking into? And Michigan and Massachusetts came up. So it sounds like the General Assembly might be doing a little bit of research on those. And then due to time, they really wanted to make sure they kept it to an hour. They weren't able to answer any more questions or ask any more questions. So they said, they'll send out some alerts on the next meeting, but it'll probably be later this spring.
Thanks, Tiffany. No, appreciate that. And one other thing, just real quick, Sloan, was there another bill you had asked about? And it was, so I put you on the spot. So maybe if you want to, I just didn't want to, I saw you on this and I didn't want to lose track of that. I didn't know if we'd gotten back to you, but we certainly, it's a Meck County bill. Okay. All right. Well, thanks for giving us a heads up, and please keep nudging if we can do anything. All right. So does anyone else have anything?
I just want to mention one thing and would love for Tiffany and then really other folks on the phone to comment on this. Like, as we head into, budget, right? We're about to see the governor's budget next week, hopefully. And as we head into budget negotiations, one of the things that I just want to kind of emphasize and reinforce is that, what the budget shows really reflects the values of our state in terms of the investment in our kids and families. And this state has been underfunding many of our systems for kids and families over the past few years. And there's a narrative that we have had over the past few years of scarcity. And there's just, what you hear a lot of is that there's not enough money. We don't have money to invest. And again, the budget is the prioritization of what's important for North Carolina. And so as we move into more heated and, more intense discussions about what we're investing money in, early education, public health infrastructure, expansion of Medicaid, like all of these things that we know will make an enormous difference for kids and families, we collectively, I hope, will push back on that narrative of scarcity and this narrative there's not enough money and that North Carolina doesn't have money. We do have money, and we have more money coming down federally, and we have what looks like a good tax revenue coming in for this year. So we have money. So like sort of as a community of child advocates, each in our different sectors, what I hope is that we can kind of collectively create a new narrative together, because our kids are depending on it. And I'd love to see us be able to kind of get in front of that sort of narrative around what's important in the budget. And we do in fact have money for what's important. We do in fact have money for kids. So I would love to hear if anybody else has any thoughts about that. I see the chat, but if anybody else has any thoughts, and if your own organizations are kind of thinking about that, I would love to hear that.
I think it's a super important point, Michelle. Thanks for bringing that up. Is like this bigger picture. How are we framing the debate? And that we just all need to be aware that, there's there's various philosophies at work on how to govern. And we have to know how to, hopefully as successfully as we can, talk about the need for these services and funding, et cetera, to the point of, like, for example, I mean, y'all may have seen, there's 21 attorneys general that are trying to strip out the $350 billion in the ARP that was going to states to help supplement states' budgets. So they're going to try to take that to court, just like how they got Medicaid expansion taken out of the ACA. And so, these philosophies then turn into strategies and tactics. And so we have to understand those and have our own ideas for how we can push and ensure that these funding mechanisms can happen and stay in place. So, we'll be keeping our eyes on that, et cetera. But you're going to start hearing that more and more, that states shouldn't even be taking this money, that we need to give it back, and they're going to ask the courts to intervene. So.
I'm seeing a few more questions pop up related to this stuff. So just a question from Greg about rolling policy and legislation into the budget. What's the advice? And I think this is a Tiffany question for, like, how do we know when that seems like the most likely path? And how do we understand the pros and cons of that strategy when it's happening?
I mean, there's no clean answer to that. Oftentimes it happens, and in my experience, I haven't really had any control over it. It's just been, I got a call from a legislator who might have been my primary sponsor on a bill, and it's, hey, this is what we're thinking about doing. And it's really kind of out of my control. And it's like, if this will get this bill across the finish line, okay. Like, so it's one of those things where whatever will get us to the finish line, especially if it's on behalf of children and babies and families. So if you want to roll it into the budget and make it a line item and it's recurring, cool, instead of it being a freestanding bill. So I hope I answer that question for you.
Yeah. And then another question I'm seeing from David Rockefeller about sort of the Leandro funding. I want to point out, I think this is an article that was in the NNO today about Leandro, just what a partisan football that is becoming too, which I think is really tragic, right? But it's a lot of funding. It's a lot of meeting kids' needs, especially kids with special healthcare needs, learning differences in rural areas, early childhood. And NC Child really kind of lets education advocacy groups stand out front on that. But we are part of that Every Child NC coalition that's pushing for that. And I think our role is more around the early childhood side of it. So we've been really working hard to try to make sure that some of those early childhood pieces of Leandro get funded. So just, so folks know that that's something that we're working on it with lots of other groups. It is a really important issue, but it's also become a very highly partisan issue, which, I can share that article out if I can find it from earlier. So any other questions coming in? I think that's sorry, go ahead.
What Senator Van Duyn, what Terry Van Duyn is saying too, is there's a provision, and a wonderful provision in the American Rescue Plan that says that if states try to supplant the federal money for state money rather than adding it to the needs, that they lose those federal dollars. And this, it's kind of similar to what happened in North Carolina, right, with the block grant for childcare, and we got an extra pot of money, but then they took out some state money. So instead of like really getting as big of an increase as we could, they just kind of switched the money around. And so this provision is supposed to stop that. But of course, that's heading to court as well.
So Melissa has a great question about how COVID has really brought people together in a more bipartisan way. And is that helpful for advocating for mental health and other services? And Melissa, I think your question is like spot on. And the answer is like, yes. And not just for mental health, for lots of issues. We're seeing that in early childhood, where, you know, lots of areas where legislators have had front row seats themselves to some of the impacts on families and kids because their families dealing with it. So I think it has been a real opportunity and will continue to be. And somebody else could have answered that question. I'm sorry. But anyway. Yep. And I think also there's lots of good discussion happening, and folks can also continue it over email and stay in touch with this stuff. So thank you very much, guys, for all the good questions and comments.
Absolutely. Does anyone have any announcements or anything else before we adjourn?
I'm going to pull up just what's coming in future meetings, Adam.
Okay, great.
There we go.
All right, thanks, Fawn. Next week, please join us as Vicki Krause on our staff will be talking about the new county data cards that NC Child will be releasing, and they're going to have an upgraded interactive format. This is a product that I know advocates across the state of North Carolina use a lot. It gives good local data, and we're really excited about this new release. So next Friday, we'll be talking about that. The following Friday, Good Friday, we'll be taking the week off. And then on Friday, April 9th, we'll be getting an update around issues related to the child welfare system here in North Carolina, presented by Karen McLeod with Benchmarks North Carolina, who knows so much of the ins and outs of kind of what's happening with child welfare, what's going on with the transformation or reform process that they've been talking about in North Carolina, et cetera. And then on the 16th of April, we will also not be having a meeting because that's our Voices for Children Awards Day instead. So we'll be hoping everyone will be joining us for that. Okay, so if no one has anything else, then we will adjourn, and we hope everyone has a great weekend, and we'll see you next Friday.